Have you ever stopped to think that a habit you consider completely private, something you do behind closed doors and perhaps rarely talk about, could actually be directly linked to your risk of prostate cancer? It's a question most men in their 40s and 50s are too afraid to ask. Maybe you've already started noticing the subtle changes, the frequent trips to the bathroom in the middle of the night, the stream that isn't as strong as it used to be, that vague, heavy sensation in your lower abdomen that just won't go away? And like so many men, you probably try to comfort yourself. You tell yourself, it's just part of getting older, everyone goes through this. You suffer in silence, hoping it doesn't mean something worse. I'm Dr. Emily Carter, a urologist specializing in men's health, and I need you to put aside the embarrassment for a moment. This video is not about cheap views, and it's certainly not about adult entertainment. This is about a medical reality that shocks many of my patients when they hear it for the first time. We are facing a contradiction. You have a biological function that affects your prostate health every single day, yet almost no man is ever given the correct user manual for it. In the next few minutes, I'm going to walk you through a specific number that has surfaced in major long-term studies, a number that might seem impossibly high to some of you. But more importantly, I'm going to explain exactly how to interpret this data safely so you don't end up stressing your body or doing more harm than good in pursuit of a perfect score. So, are you ready to face the truth about your prostate? Let's be honest, most men live their entire lives without giving their prostate a second thought, until the plumbing starts to fail. Usually it starts with that annoying urge to wake up at 3 a.m. or the realization that you're standing in the bathroom for what feels like an eternity just to empty your bladder. But to understand why ejaculation frequency might matter, you first need to understand what this organ actually is. Think of your prostate as a small factory about the size of a walnut, sitting right at the crossroads of your body. It is located directly below your bladder and wraps around your urethra, the tube that carries urine out of your body. This little factory has one main job: to produce the fluid that protects and nourishes your sperm. It is essentially the engine of your fertility. And like any factory, it is constantly running, constantly producing fluid day and night, regardless of whether you are sexually active or not. Now, before we go further, I want to clear up a major source of anxiety. In my clinic, when a man walks in with urinary issues, I can almost smell the fear. He is thinking, is it cancer? Here's the reality. As you age, this factory naturally gets bigger. We call this BPH, benign prostatic hyperplasia. It is not cancer, it's simply the prostate growing larger and squeezing that tube, making it harder to pee. Think of it like getting gray hair or wrinkles. It's an annoying part of aging, but it's not malignant. However, here is the danger of complacency. Because symptoms of an enlarged prostate and prostate cancer can feel very similar, many men dismiss early warning signs thinking, oh, it's just old age. Or conversely, they live in constant silent terror. But here's where things get interesting. Since this factory is constantly producing fluid, accumulating chemicals and biological byproducts, what happens if that product just sits there? What happens if the factory never opens its doors to clear out the inventory? It is right here, at the intersection of continuous production and lack of release, that a major medical hypothesis was born. And it changes everything about how we view ejaculation. I want you to imagine for a moment the plumbing in your home, or even the oil filter in your car. What happens if water just sits stagnant in a pipe for months? Or if a filter collects debris but is never changed or cleaned out? Eventually, sediment builds up. Bacteria start to breed. The system becomes toxic. This simple engineering principle is the foundation of what we in the medical community call the prostate stagnation hypothesis. You see, the fluid your prostate produces isn't just water. It is a complex chemical cocktail containing citric acid, enzymes, zinc, and other biological markers. The hypothesis suggests that your prostate is also capable of concentrating certain chemical substances from your blood, some of which can be harmful. We call these potential carcinogens, cancer-causing substances. Here's the theory. If you do not ejaculate regularly, these fluids sit inside the gland. They age. They become stagnant. Over time, this accumulation creates a pro-inflammatory environment. It's like leaving the trash in the kitchen for too long. Eventually, it starts to rot. This internal inflammation causes oxidative stress, which can damage the DNA of healthy prostate cells. And when DNA gets damaged, that is the very first step toward the mutation that leads to cancer cells. So logically, ejaculation acts as a biological flush. It clears out the old fluid. It removes the potential carcinogens before they have a chance to settle and cause damage. It forces the factory to produce a fresh, clean batch of fluid. It keeps the pipes clear. It sounds incredibly logical, doesn't it? It makes perfect sense intuitively. Use it or lose it. Flush the system to keep it clean. But in science, intuition isn't enough. A theory is just a guess until you measure it. We needed hard numbers to prove if this flushing mechanism actually saved lives in the real world. And that is when the researchers stepped in. They started counting, and the numbers they found forced the entire medical community to rethink the advice we give to men. We are not talking about a small survey done on a few dozen people. We are talking about one of the most comprehensive studies in medical history, the Harvard Health Professionals Follow-Up Study. Researchers tracked nearly 32,000 men. They didn't just watch them for a week or a month. They followed these men for 18 years. They tracked every aspect of their lives, their diets, their health habits. And yes, they asked them the awkward question, on average, how many times do you ejaculate per month? When the data was finally analyzed and published in the journal European Urology, a clear pattern emerged that surprised even the skeptics. They compared men who ejaculated 4 to 7 times a month against men who ejaculated 21 times or more per month. And here's the headline that went around the world. Men in the high-frequency group, at least 21 times a month, had a roughly 20% lower risk of developing prostate cancer compared to those in the lower frequency group. Let that sink in for a moment. A 20% reduction in risk. In the world of cancer prevention, a double-digit decrease simply by changing a lifestyle habit is significant. And this wasn't just true for young men in their 20s. The study found that this protective benefit held true for men in their 40s significantly as well. This suggests that the flushing mechanism we talked about earlier isn't just a theory. It appears to have real-world consequences. So, purely from a statistical standpoint, the magic number, if you want to call it that, is 21. Now I can almost hear the collective gasp through the screen. I can see some of you doing the mental math right now, calculating your weekly average, and suddenly feeling a wave of panic. 21 times? That's almost every day. I have a job, I have kids, I have stress. I'm nowhere near that number. Am I doomed? This is the moment where I need you to stop. Take a deep breath, because data without context is dangerous. While the number 21 is the statistical ideal for risk reduction, chasing that number blindly can actually create a whole new set of problems. And for some men, aiming for 21 might actually be the wrong advice. Here's the nuanced truth that headlines often leave out. You're not a machine, and your body at 50 is not the same as your body at 20. If you start treating intimacy or self-pleasure like a chore, like a mandatory checklist item that you must hit 21 times a month, you are missing the point entirely. In fact, you might be doing damage. When you force sexual activity when you are tired, stressed, or simply not in the mood, your body releases cortisol and adrenaline. These are stress hormones, and guess what? Chronic stress is also a risk factor for prostate inflammation. So if you turn pleasure into pressure, you are essentially canceling out the benefits. Furthermore, we have to look at your overall biology. If you have low testosterone, erectile dysfunction, or take certain medications, reaching that high-frequency number might be physically exhausting or impossible, and that is okay. The research shows a trend, not a cliff. It's not as if doing it 20 times means you fail, and 21 times means you are safe. The key takeaway is simply, more is generally better than none. Even if you are in the 8 to 12 range, you are still keeping the system active compared to someone who is completely sedentary. But here's the biggest mistake men make. They focus entirely on this one number and ignore the foundation. You cannot ejaculate your way out of a bad diet. If you are hitting the number 21 but you are also smoking, eating processed meats, sitting on the couch for 10 hours a day, and carrying excess belly fat, your prostate is still in danger. Metabolic syndrome, high blood pressure, and obesity are massive drivers of prostate cancer. Think of ejaculation as just one tool in your toolbox. It's a powerful one, yes, but it needs to be combined with lycopene-rich foods like cooked tomatoes, regular exercise to boost pelvic blood flow, and quality sleep. So my advice to my patients is always this. Listen to your body, aim for consistency, not a quota. Keep the factory running, but don't burn down the machinery in the process. However, even if you do everything right, even if you have the perfect diet and the perfect frequency, There is still one critical step that absolutely no man over 45 should skip. And skipping this is the only thing that truly scares me as a doctor. So, here's the bottom line. Ejaculation is a healthy, natural part of a man's life, and the science suggests it plays a valuable, protective role for your prostate. It keeps the factory clean, it reduces stagnation. But please, hear me clearly. It is not a vaccine. You can hit the magic number of 21 every single month and still be at risk if you ignore the other signals. That is why the critical step I mentioned earlier is screening. A simple PSA blood test and a checkup with a urologist once a year after age 50 or 45 if you have a family history saves more lives than any habit in the bedroom ever could. Don't let embarrassment prevent you from getting checked. Don't let silence be the reason you suffer. If this video helped you understand your body a little better today, if it replaced your anxiety with knowledge, then please let me know by hitting that subscribe button. My goal with this channel is to give you the honest, unfiltered medical truth that most men are too afraid to ask for. And speaking of signals, how do you know if your prostate is already in the trouble? In the next video, I am going to reveal the early warning signs of prostate problems that most men mistake for just aging until it's too late. You see that video on the screen right now? Click it. It might just be the most important video you watch this year. Remember, taking care of your health isn't about fearing disease, it's about respecting the body that carries you through life. Listen to it when it speaks. I'm Dr. Emily Carter. Stay healthy, stay proactive, and I'll see you in the next video.